If you are someone who suffers from chronic or repeated sinus infections, you may be a candidate for endoscopic sinus surgery. But before we look into the actual procedure, let's examine what sinusitis is. Sinusitis is defined as an inflammation of the inner lining of the air-filled spaces in the cheeks, forehead, and the roof and back of the nose. This inflammation may be from a blockage of the opening of the sinus, or it may be from an infection from bacteria, virus, or a fungus. The pressure from the blocked sinus and the irritation of the inflamed sinus causes facial pain and pressure headaches. Endoscopic sinus surgery may be for you if you have recurrent sinus infections that have been treated with multiple medications such as nasal sprays, antihistamines, and antibiotics. Other common causes include the presence of nasal polyps, severe sinus disease, or an expanding mucus cyst called a mucocele. Endoscopic sinus surgery is performed while you are asleep under general anesthesia as an outpatient. You should anticipate going home the same day. To begin the procedure, a thin, lighted instrument called an endoscope is placed inside the nose without making any incisions in the face. Using only endoscopic equipment, the tissue that is blocking the nose and sinuses, such as polyps, thickened mucosal lining, or scar formation from repeated infections, is removed. The sinuses are identified, cleaned, and then washed out of infection. The diseased lining of the sinus is also removed. For more advanced cases, Dr. Pasha may choose to use a computer to confirm the location of the sinuses throughout the case. Another technique that Dr. Pasha has special certification is balloon sinuplasty, which is a catheter-based system in which a small flexible balloon wire is placed into the opening of the sinus and then blown up to widen the natural openings of the sinuses. This is much less invasive by maintaining the integrity of the lining of the sinus. Typically, Dr. Pasha will also recommend a septoplasty turbinate reduction in order to allow you to breathe better through your nose, as well as making it easier to access the sinuses using endoscopic instruments. The wall that divides the left and right side of the nose is called the nasal septum. This wall is made up of both bone and cartilage. For some, the septum may be crooked or deviated. This could have occurred from trauma, perhaps as a child, or it may be something you were born with. The turbinates are fleshy shelves on the side of the nasal cavity that congest and decongest, but for some may cause continual blockage of the nose and sinuses. The turbinates are what enlarge when one becomes congested, oftentimes from allergies or a cold. If the turbinates are inflamed for prolonged periods, they may become persistently enlarged. A septoplasty and turbinate reduction is performed prior to addressing the sinuses. Once you are asleep, a single incision is made inside the nose on the septum to access the cartilage of the septum. This incision will not be visible. The septum is then straightened by reshaping the cartilage. The turbinates are reduced by removing a small bone from the inside of the turbinate. This allows the turbinate to collapse without destroying the outer mucosal layer of the turbinate, which participates in keeping the nose moist and directing airflow. Upon completion of the septum and turbinate operations, the sinuses will be addressed. Once this is complete, a plastic splint is placed inside your nose to prevent the septum from moving as well as reducing the risk of scar formation. The total time for this sinus and nasal procedure may take from 45 minutes to a few hours, depending on the complexity. Afterwards, there are 3 common complaints. The first is that you will not be able to breathe well through your nose. Although the plastic splints have a channel that allows you to breathe, this channel is often clogged. Dr. Pasha rarely uses packing or cotton in the nose. If you speak to other patients who have had a nasal operation by another surgeon, they may say the worst part of the procedure is when they remove the packing. You will not have this experience unless you bleed. This is the reason why Dr. Pasha uses dissolvable packing instead of traditional packing or cotton. Nonetheless, you will have post-operative drainage for 2 to 4 days. Finally, you will be congested until the splints are removed 1 week later. After that, you should find a dramatic difference in your nasal breathing once the splints are removed. The second week, Dr. Pasha will take a second look in the sinuses in the office and clean out any remaining debris. Significant pain and discomfort is uncommon after the first 1 to 2 days. This is not a cosmetic procedure, and the nasal bones are not touched. Only the inside of your nose is changed. No one should be able to recognize that you had a nasal operation except for the fact that you breathe better. Endoscopic sinus surgery, as well as septoplasties and turbinate reductions, are routine cases with rare complications. The more common risks of the procedure is bleeding. If this occurs, you may require nasal packing, which is often removed in the operating room to avoid further discomfort. Other rare risks include reoccurrence, especially if you do not take care of your nose afterward with nasal sprays and allergy management. The risk of general anesthesia as well as other rare complications will be discussed with you in the office. Patients find that sinus surgery provides a dramatic difference in the way they breathe. Many patients who are lifetime mouth breathers are shocked by the benefits of properly breathing through the nose. We hope that you have a better understanding of nasal surgery, and we look forward to helping you breathe freely, both day and night.